All right, let's talk about type 2 diabetes. We're going to dive deep into one of the most powerful and honestly most misunderstood tools for managing it, insulin. We're going to break down what it really is, how it works, and why getting a grip on it early can literally change everything. Let's get into it. So, when you think about diabetes, what's the first thing that pops into your head? High blood sugar, right? It's the number we're always told to track, the thing to control. But what if that's just a symptom? What if, by focusing only on the sugar, we're actually missing the real story of what's going on inside our bodies? You see, to really understand diabetes, we have to look past those blood sugar readings and get to the root of the problem. And it all boils down to a pretty simple but absolutely critical breakdown in communication between our own cells. This slide just lays it out perfectly. The common view? High sugar is the problem. End of story. But the clinical reality, what experts like Dr. Luis Campanella will tell you, is that the high sugar is just the tip of the iceberg. It's the result of a much deeper issue, a total metabolic failure. Your body's whole communication system is kind of on the fritz. Think of it like this. Insulin is the key. Its job is to unlock your body's cells to let sugar, glucose, in for energy. But in type 2 diabetes, the locks on those cells get all rusty and resistant. The key just doesn't fit right anymore. And the result? All that sugar gets stuck in your bloodstream with nowhere to go. So if the lock is broken, what do? You don't just give up, right? You bring in a better set of tools. It's time we stop thinking of insulin as some kind of punishment or a last-ditch effort and start seeing it for what it truly is, a really sophisticated toolkit for managing this disease. And let's be crystal clear on this point because it's so important. Starting insulin is not a sign that you failed. It doesn't mean you didn't try hard enough or do enough. No. It is a proactive, powerful, and often life-saving step to protect your body from the long-term damage of high blood sugar. It is a tool, a life-saving one at that. And this toolkit has two main instruments. First, you've got your basal insulin. Think of this as the foundation. It's working quietly in the background, giving you a steady, all-day level of control. Then you've got bolus insulin. This one acts as the shield, defending your body against the sudden sugar spikes that come from eating a meal. Let's take a closer look at the toolkit. Your basal insulin, the foundation, is the long-acting, slow-drip kind, like Largine, that keeps your liver's glucose production steady 24/7. Then there's your bolus insulin, the shield. That's your rapid-acting rescue dose, like Lispro, that you take with food to handle those immediate sugar rushes. See? Two different tools for two very different but equally important jobs. Okay, so now we understand the tools. They make sense, but there is a huge barrier that stops so many people from using them effectively. And it's not a physical one, it's psychological. The true enemy we really need to face isn't a medication, it's a feeling. And wow, this quote from Dr. Campanella just hits the nail on the head. The biggest danger in diabetes isn't the insulin, it's the fear of insulin. That fear is often more dangerous than the disease itself because it leads to one critical and very damaging decision: to delay. And this slide shows that chain reaction perfectly. It all starts with fear. That fear leads to putting off treatment, delaying the start of necessary insulin therapy. And that delay, where blood sugar stays dangerously high for months or even years, leads directly to damage that you just can't undo. And the consequences of that delay are just devastating. We're not talking about some abstract idea of damage. It's real. The constantly high blood sugar destroys the tiny, delicate blood vessels in your hands and feet. This can lead to a condition called diabetic foot, which can tragically result in amputation. So let's dismantle that fear. Right now, we're gonna go rapid fire and bust 3 of the biggest, most common myths about insulin with some simple, straightforward truths. First up, the addiction myth. The truth? Not even close. Insulin isn't a drug, it's a natural hormone your body already makes. When you take insulin, you're just giving your body more of something it desperately needs but can't use effectively anymore. You can't get addicted to something that's essential for life itself. Okay, this one is a really tragic and dangerous misconception. The myth is that insulin causes blindness. The truth? Uncontrolled diabetes does. It's the chronically high blood sugar that damages the delicate blood vessels in your eyes. Insulin is the tool we use to prevent that from happening. It's confusing the treatment with the consequences of the disease. And finally, the fear of the needle itself. You know, that image of the big, scary syringe? That's completely outdated.
Today's insulin pens use these ultra-fine, super short needles that make the whole process quick, easy, and for most people, that sting is barely even there. So, we've busted the myths, we understand the tools. Now it's time to bring it all home. It is time to take control. This is it. This is the whole thing in a nutshell. Taking an early and firm grip on your glycemic control, using every tool in the toolkit, including insulin when it's needed, is what saves limbs. And ultimately, it's what saves lives. So look, you have the tools now. You know the truth. Insulin isn't the enemy. Fear and delay are. The power to change the outcome of this disease is right there, and it's based on making proactive, informed decisions. So the only real question left is, how will you take your grip?